Let's now bring in Dr. Dale Kalina, infectious disease physician at Joseph Brand Hospital. Doctor, good evening and thank you for your time.
Thanks for having me, Akshay.
So a sixth Canadian has died from the salmonella outbreak in the country. Public Health Agency of Canada says the majority of those who were affected became sick between mid-October and late November. I hate to ask this, but do you think there could be more deaths on the way?
So I don't expect that there are more deaths on the way, but I expect that we might see more cases and perhaps more deaths that are attributed to these cases. You mentioned majority of these cases have all been seen between late October and throughout November as well. And we haven't yet seen any cases whatsoever, cases or deaths either. In individuals after December as well. So I'm hopeful that although we might still see cases that are attributed to the outbreak during that time frame, that hopefully it is not ongoing.
So will it be safe to say, doctor, that at this point in time, the outbreak has been contained because we haven't heard of any fresh cases in December?
Well, I think that's what we're hoping for, but the reality is with salmonella outbreaks, particularly tied to cantaloupes, that we can see that are cases that are a little bit more spread out. And that's partly because cantaloupes actually have a surprisingly long shelf life. So people may have bought the cantaloupes between those dates, which are, I believe, October 11th to November 24th. But those cantaloupes can still be good enough to eat kind of to the average eye. So it is a reminder that if you have one of those cantaloupes at home from one of the brands that have been advertised, or if you're not aware of what it is, just throw it out. You shouldn't be having it. Or if it is in any way suspect, don't eat it.
I'd like to just understand one more time, doctor, on the kind of effect that salmonella really has when it comes to adults versus children.
Yeah, so just like many infections, the extremes and the worst that we see of a variety of infections will be seen in young ages and also in very old ages. So with salmonella, you can have everything from an asymptomatic infection, which can then spread to other people, to severer infections, gastroenteritis, nausea, vomiting, diarrhea, things like that. And then you can even get more severe infections, such as bloodstream infections, heart valve infections, for example, and they can in fact be fatal. So it's a very, very wide range of conditions that can be associated with this bacterial infection that we more frequently do see at those extremes of age, babies and in elderly folks.
And once infected or affected, what is it that people should be doing?
Yeah, so if you are infected or if you're concerned, if you're feeling nauseated, vomiting, diarrhea, any other symptoms, really you should be going into a hospital or seeking advice from your medical provider. This is an infection that can be treated with antibiotics, and there are a wide variety of antibiotics that are available for salmonella infections, and they can be administered in a hospital and oftentimes outside of a hospital as well. So seek medical advice if you're feeling any of these symptoms.
Dr. Kalina, have a great rest of your evening. Thank you for your time.
You too, Akshay.